my name is Monica. I'm a fourth-year pharmacy student at Drake University, and today I'll be providing a brief review and summary of the 5 Gs of dietary supplements, and specifically how they relate to potential drug interactions with antiplatelet and anticoagulant therapies. So a few objectives. So today, again, I'll be reviewing information provided specifically in the Natural Medicines database for the 5 Gs, which include garlic, ginger, ginkgo, ginseng, and glucosamine, in relation to the bleeding risk that they may pose when taken with antiplatelet and anticoagulant medications. I'll address the theoretical or the studied mechanism of actions of these interactions, as well as to list resources available for student pharmacists and pharmacists, just to reference when posed with questions from healthcare professionals or from patients, just to make sure that patients are able to safely take dietary supplements or to help provide information to decide whether or not they want to pursue dietary supplementation. So of course, when we think of warfarin, we think many drug interactions, diet interactions, etc. And so I just provided here a brief excerpt from the warfarin package insert, specifically with a couple of different dietary supplements that we'll be covering today. So it's important, just as healthcare professionals in general, to be able to monitor a patient's INR and adjust their dose and understand how outside factors can impact the INR and the bleeding risk that's associated with warfarin as well. So for our first G, we will briefly review garlic. So garlic powder or raw garlic have been found to have a couple of different interactions with platelet aggregation. So garlic may increase fibrinolytic activity and prothrombin time and ultimately decrease platelet aggregation and adhesion, while also inhibiting certain metabolic enzymes in platelets that play a key role in platelet aggregation. So garlic has been rated by Natural Medicines as possibly effective in a couple of different disease states, such as CVD, diabetes, hyperlipidemia, and hypertension. There is a bit of a differentiation in natural medicines between the garlic powder or the raw garlic versus garlic oil, as garlic oil has not appeared to have that similar platelet aggregation effect that the powder or the raw garlic may provide. And so, as briefly mentioned as well in the warfarin package insert on one of the first slides, these antiplatelet effects actually have appeared in individuals with and without cardiovascular disease who took these garlic supplements. So even if we may encounter a patient that is only on a garlic supplement and not necessarily on an antiplatelet or anticoagulant medication, they still may experience that increased antiplatelet effect. So Natural Medicines has rated this a moderate interaction rating for antiplatelet and anticoagulant medications, which essentially means to use caution when combining those. So moving on to ginger, Natural Medicines has rated ginger as possibly effective in certain disease states such as osteoarthritis and pregnancy-induced nausea and vomiting. So lab research has suggested that ginger may inhibit thromboxanase synthetase and decrease platelet aggregation. But essentially it has been found that this is a proposed mechanism or proposed effect that has truly not been fully demonstrated in humans. And so longitudinal analysis suggests that taking ginger could potentially increase the risk of bleeding in patients on warfarin for at least 4 months. So overall, Natural Medicines, of course, recommends to continue to monitor the INR very closely in patients taking large amounts of ginger. And so again, the interaction rating for this dietary supplement in combination with antiplatelet and anticoagulant medications, as well as specifically addressing warfarin, is moderate, so use with caution. Moving on to ginkgo, Natural Medicines has rated this as possibly effective in anxiety, dementia, schizophrenia, stroke, etc. And so ginkgolide B in the leaf actually competitively inhibits PAF, or platelet activating factor. And so by inhibiting that and binding at numerous membrane receptors, it can also inhibit the formation of platelet thromboxane A2 and B2, thus resulting in decreased platelet aggregation. And so with the level of evidence of B for the interaction with warfarin, studies have shown in a previous large medical database review that individuals taking both warfarin and ginkgo concurrently have an increased risk of bleeding by 38%. So in theory, it may interact with other anticoagulants and antiplatelets, but it specifically addressed warfarin. And so the jury is still out, and there's many mixed results on whether these effects occur from short-term or long-term use of ginkgo. But again, the interaction rating for ginkgo in combination with antiplatelet or anticoags is a moderate rating. So I've broken down the ginsengs into Panax ginseng and American ginseng, since actually they have separate recommendations from natural medicines. So this has shown to be possibly effective in a couple of different disease states, including influenza, ED, and cognitive function. So in the lab, it has shown antiplatelet effects, but really it's unlikely to increase the risk of bleeding if used with other anticoagulants and antiplatelet agents. And so the rating for this specific form of ginseng is moderate, or used with caution. Now, American ginseng, it has been rated as possibly effective in diabetes and respiratory tract infections, and these actually contain a higher amount of certain ginsenosides. And so there are over 30 different types of them. However, the American ginseng has higher components of this. So unfortunately, this dietary supplement is likely to decrease the effectiveness of warfarin therapy. And so one study showed that healthy patients who received warfarin 5 milligrams in combination with American ginseng concurrently had seemed to have a significantly reduced INR. So for this specific formulation of ginseng, the interaction rating with warfarin is major, or do not take these medications in combination. So glucosamine, it's a very common dietary supplement, especially used for osteoarthritis. And so glucosamine is a small part of heparin with unlikely anticoagulant activities. And chondroitin, it is commonly used in combination with glucosamine. It also is a small component of heparinoid with possible weak anticoagulant activities. So this medication or medications or dietary supplements have the potential to increase the anticoagulant effects of warfarin, and so patients may be at increased risk for bruising and bleeding, as stated with the voluntary case reports to the FDA, as well as multiple case reports through the World Health Organization as well. So again, unfortunately with this medication, the interaction rating through natural medicines, and specifically with warfarin, is major, or do not take warfarin in combination with glucosamine. In summary, there are going to continue to be ongoing studies to be able to provide more information about the safety and efficacy of dietary supplements. So really, us as student pharmacists and pharmacists can really play a key role in helping identify, mitigate, and minimize drug interactions with dietary supplements as well. So it's always important to ask patients what herbal or dietary supplements they use on a regular basis, just to make sure that we have the most up-to-date med list and we're able to analyze and mitigate those interactions. I provided a couple of example available resources for dietary supplements. So the first two, NIH Office of Dietary Supplements and American Botanical Council, are just two free resources available to healthcare professionals and the general public. And then again, the main database and the only database that I used to formulate this presentation, called Natural Medicines Database. So again, thank you so much for listening in. Take care.